Hey everyone, it's Caitlin. I'm just doing my reflection speech on the field of anatomy and physiology and how much it ties into the field of dental hygiene. It's amazing how much our body does interrelate and it works throughout the entire body to where even a field like dental hygiene that you're dealing with their mouth, how much even just the heart, the blood vessels can all interrelate. So let's first start off with the blood. A big thing that we would want to know before our patients come in or before we start on them is that they are on a blood thinner. A lot of times we're going to go deep under that gum line subgingivally and clean around that tooth, and it will establish bleeding. If we know ahead of time that they are on a blood thinner, we will know that it's going to have a tougher time clotting that blood. It's going to have a tougher time establishing a blood clot. So if we know that, we know how to deal with it beforehand. We know if we need to have them go off the blood thinners before their dental cleaning, or how we can deal with it differently during the dental cleaning. If our patients have to get an extraction, we know how to carry that knowledge onto the doctor so he knows if he needs to have them taken off of those blood thinners before he does an extraction. The circulation of the blood is a huge one because a lot of dental offices will do blood pressure checks before they see their patient. We are in a field where our patients come to us regularly, say every 6 months. If they have issues, sometimes every 4 months. They don't always go to their other doctors or their other practitioners for regular checkups like that. So us doing a blood pressure check first can help diagnose if they have hypertension, if they have early onset diabetes, because diabetes is a silent killer. A lot of people don't understand or know that they have it before it's a big issue. So if we can see what their diastolic and their systolic levels are of their blood pressure, we can help tell them, something's going on, you need to go see your practitioner. Elevated blood pressure is another one. If we can see, hey, their blood pressure is elevated, they may be nervous. We can do something like nitrous oxide during our cleanings. We can do some deep breathing with them. We can talk them through maybe the nerves that they're having about getting a dental cleaning. The next thing is the heart. The heart is huge because all of the debris that we are going to remove during the cleaning, the bacteria, can go into the lymphatic system, into the blood system, and it can go down and infect the heart. And so if we know ahead of time, they have heart issues, they've had heart surgery, stents, anything like that, a lot of times we will have them do a pre-medication with amoxicillin, for instance, to where an hour before their appointment, we give them that dose of antibiotic to help fight any bacteria that may be stirred up. Periodontal disease is a huge problem when it comes to also heart disease. They can interrelate and really cause damage. The blood vessels are huge as well because we will do injections on our patients from time to time. We will have to numb them before we clean their teeth, especially in those that do have periodontal disease, like I discussed, that have to do with the heart. So knowing all of the blood vessels and their placement in the mouth, in the cheeks, in that region is how we are going to know where to inject, what areas to numb up before we do those cleanings. The tongue has so many blood vessels, and we're going to experience things with the tongue where we have to diagnose other problems. If we see there's problems with the tongue, it can interrelate to other health problems, and that's another thing that we would refer them to a physician to see. The lymphatic system is one that is constantly going. It drains edema, fluid, exudate, clears the cellular debris and foreign matter. So as we are cleaning and removing the bacteria, it's going to go into that lymphatic system, and so we totally deal with that. Pockets of pus sometimes develop if they have infection in their mouth. Immune system is another one that relates to gum and periodontal disease. Educating our patients on proper brushing techniques and the need to brush at least twice a day, to floss. Having a weak immune system can be detrimental to our mouths in order to fight off periodontal disease, in order to fight off any other disease. Cancer patients come to us before their treatment to be able to remove any debris so they don't have a problem with their cancer treatments. So hopefully that's a good overview of what we've gone over.